Today, we will talk a little bit in more detail to understand certain fundamental concepts in CBT for your own help. In this video, I will be covering cognitive errors or cognitive distortions that we come across in people suffering with a range of mental health difficulties. 6. Magnification or minimization. And in this, an individual either tends to magnify the negatives of a situation or minimizes the positives in that situation. Number 7. Mental filter, also called as selective abstraction. And in this, an individual tends to selectively pay attention to all the negatives in a given situation and discounts anything that has been positive or good in that situation. Common example could be had a good appraisal, however, had some things that they needed to improve. And selective abstraction would make them only think about all the not so good things that have come up in that appraisal and resulting in them not paying attention to all the several achievements that they have achieved and have done well on, which makes them clearly distressed by that selective abstraction. Number 8, called mind reading. And in this, an individual starts already thinking that they can read the other person's mind and therefore know what is going to happen without realizing or being patient enough to understand that the other person might have a very different thought process or a mindset. Number 9, overgeneralization. And in this, what tends to happen is that individuals pass on negative, sweeping conclusions about a given situation. And an example could be that because I was not comfortable in one group of a social situation, that means that I have no qualities to make friends. 10. Personalisation. And in this, often the people think that everything that is happening around them is something to do with them, and they take any statements or comments personally, causing them distress. 11th is should and must statements. And in this, what happens generally is people make up their own rules which are about they should be doing X, Y, and Z, or they must be doing X, Y, and Z. And if they don't, then they are no good, or other cognitive errors start appearing when they start using these statements. Number 12 is tunnel vision or tunnel thinking. In this, the individual can only think in a blinkered and in a tunnel way where only the negative aspects of a situation is seen without any consideration of anything else. All of these 12 cognitive errors or cognitive distortions are important for the therapist and also for you to know, because once you start recognizing these, then you would be able to challenge some of these thought processes and start putting in more realistic, rational thoughts so that that can improve the way you respond in a given situation and perhaps not feel as bad or distressed as you usually do. We will be covering further aspects of CBT or your self-help in the upcoming videos. If you're new to this channel, please press that like button, subscribe to the channel, comment, share, and engage with us so I can bring you more tips to help you with your mental health.